Access for kids to dental care is a problem throughout the country, but it's worse in Wisconsin than anywhere else in America. In fact, we have the lowest dental access rates for Medicaid eligible kids in the United States, and it's really a tragedy. It's a tragedy for kids. It's also a tragedy for communities, for parents, for taxpayers.
Smile.
Dental therapists are mid-level professionals, often compared to nurse practitioners or physician's assistants. They work under the direction of dentists.
My scope of practice encompasses pediatrics, so I can do anything with children with disabilities, medically compromised patients. I have a lot of geriatric patients that I see over at Como, which is great too. And then other clinics are actually referring the kids to come see me because pediatrics is so far pushed out too. So if the child just needs general care, then I can help, do the fillings and do the sealants, and help with the stainless steel crowns sooner so they don't have to wait so long.
We have a solution. We think that we should emulate Minnesota. Minnesota has had dental therapists for 10 years, and it's been a real solution to a real problem. Dentists in Minnesota were initially opposed as well. About 80% of them were opposed. They saw it as competition. It turns out that now, 10 years into it, 70% of dentists in Minnesota think it's a good thing. And in fact, some of them are clamoring for dental therapists because they see that it's a good thing for kids. It's also a good thing for dentists who can work with these therapists and build their own practices. So we think this is a real solution for Wisconsin, and we're glad that legislators are considering a fix.
It was introduced that we were considering taking on dental therapists. There weren't very many dentists who were in favor of that. They were concerned, they had the same concerns as every dentist in the state. I felt it would not be a hard step to train dental therapists to work with the same philosophy of care as what we have at Health Partners, and that's why I thought this would be a great group of practitioners to bring on board to help us out. The process of having the dental therapist introduced at the clinics was literally, we'll convince one dentist at a time, and that's how it worked in Health Partners, is that the dental therapists were oftentimes asked to come in because there was a backlog of patients, and once the dentists saw the level of care that they were receiving, they became big supporters of this program.
You can get seen sooner, you can still get really high quality care, and we take your insurance.
The Minnesota Department of Health found that dental therapists provided care for 100,000 patient visits in 2016. Dental therapists cannot open up a shop down the street from a dentist, so they're not in competition for each other. Rather, dental therapists can be a tool for dentists. The Minnesota legislation requires that dental therapists mostly serve underserved, uninsured, or low-income patients in areas designated as dental health professional shortage areas.
You're going to pay me a lot less to give very high quality patient-centered care. Patients don't have to wait so long to get seen, so that way the kids that have higher needs that need to be seen in a hospital setting can get in with a specialist sooner. And Dr. Nakagaki, who I work with, works in a hospital setting too, so by me seeing a lot of his patients, he's able to have more time to see those patients in a clinical. States are spending millions of dollars on emergency dental care visits that are 100% preventable.
So what we found is that the dental therapy group can provide high quality dental care at a lower cost, so that it allows us to treat more patients in this population without driving up the cost. Their skill level is excellent. It's not a question of whether or not they're trained well enough. They absolutely are. There have been no concerns in terms of malpractice, or their production is approximately 81% of the production of a new dentist.
If dental therapy passes in your state, it's not mandated that you have to hire a dental therapist. If you don't want to hire a dental therapist, don't hire a dental therapist. That's fine. But if you have a need, if you want to serve this patient population, then this is a tool for you to use in order to help you do that. As Dr. Nakagaki says, work smarter, not harder. So we're trying to make it easier to get high quality patient-centered care to patients, and we're helping to try to make that easier on clinics too, because we know the reimbursements are so low. So this is a way that you can do that. And you can hire a provider to see all your state-based insurance patients and all of your children. I mean, bring it on. We love it, and we love serving this. I mean, I love serving this patient population. It is working in Minnesota. It's very successful. I'm very successful. I love my job.
It works in Minnesota, and we know it can work in Wisconsin.